I am Deanne Berry, and I am the Director over Critical Care. I am also the Program Director over Cardiac Rehab and Pulmonary Rehab. Our biggest needs right now in the Critical Care Department are night shift. We work 12-hour shifts. I try to offer the flexibility of block scheduling on night shift. We typically hire RNs, and then during the orientation process, if we need to add ACLS, BLS, and CPI, which is a de-escalation technique that we use here at Henry County, we incorporate that into the orientation process. So we are just looking for RNs. They need to have initiative to want to learn. They need to be eager to learn. They also need to have a strong backbone to where they are a patient advocate, because in the critical care unit, situations can change so drastically that we need to stay focused on the patient and what the patient needs. And that takes some encouragement and some strong voice to be able to do so. We have a 9-bed critical care unit. We are able to take on ventilated patients. We have a vascular surgeon that performs 10 to 15 admissions a month where he will address a patient's vascular needs. We have state-of-the-art equipment where we can provide monitoring for our critical care patients as well as our telemetry patients in-house. We have a very strong pulmonologist here at Henry County, and he is very responsive to our patients that have lung disorders or needs from a pulmonary standpoint. I have worked at Henry County for 20 years collectively, and I believe that the staff nurses are very supportive. We have 24-hour nursing supervisor coverage, so anytime there is a question or a concern that needs to be escalated, we would reach out to her as a resource. And then if something is above her head, then she can reach out to 24/7 coverage from administration on call. They're always responsive and available if that need arises. So I feel like the staff nurse is supported in more of a way now than we have been in the past. So the nursing supervisors, along with the nurse director team, meet multiple times a day to discuss staffing, and we really focus on safe nurse to patient ratios. We do take into consideration acuity, so it's not just numbers. If the acuity is high in the unit, then we look for resources elsewhere. If we need to provide CNAs or patient care techs, we would do so. We strive to keep a safe nurse to patient ratio, and I do believe that we have met that goal for quite some time here at Henry County. I think the most important quality is the teamwork that the critical care team has. There are situations where it's going to take more than one nurse to tackle whatever scenario is happening, and I am so proud of the team that they pull together and work through that. That is a very unique qualification, but it's a must qualification to work in the critical care unit. We strive to have a 2-to-1 nurse to patient ratio. Sometimes it's a 3-to-1 depending on the acuity, and it takes everybody to be able to take care of that type of a patient.
My name is Rachel Carroll, and I'm the HR Director at Henry County Medical Center. We invite you to apply on our website at hcmc-tn.org or call the Human Resource Office at 731-644-8472.